Hello, everybody. Welcome to this masterclass with Dr. Marco Zeltner today. We have a great, fantastic topic to talk about. But before we start to give the word to Marco, the topic is today the future is abutment-free, AI-powered efficiency for your dental practice. Before I give the word to Marco, I would like to introduce myself. My name is Holger Kast. I'm the head of training education. I'm going to moderate this webinar today. And I would like to take a little bit of time to explain a little bit about the TRI company as a company and also the matrix implant, the abutment-free, the world's first implant for an abutment-free workflow, the world's first digital implant. And let me start. TRI. We have certain values, and first of all, we are a Swiss company. We produce our implants in Switzerland. We work every day with a high performance, and that's the second value we are getting up in the morning for. And for me, always very, very important is the simplicity. So TRI is focusing on simplicity. We try to give solutions for our customers every day more and more simple. And as the topic says today, we talk about abutment-free implantology as well as AI designed design crown designs. And this is making your life very more simple every day. So simplicity in our everyday values is very important. And think digital is the main point, I think, in our day as an implant company. We try, our goal is to give you 100% a digital workflow. So the digital workflow means we start our work really in a digital way. But before I would like to give you a little bit of background of the history of TRI. So TRI, we started to develop implants already 15 years almost ago, and we started the journey with the performance line. And in this time, the performance line is an abutment-based implant system, a classical implant system, as every company has it with a tissue level implant and a bone level implant. And also here on this little picture, you can see already there we were very innovative in this time, and we created also a pink anodized surface on our tissue level implants to have a more aesthetic aspect, which had quite a good impact to show that we create innovative products. But now the focus in already like 7, 8 years ago, we get into this developing phase of the matrix system. And the matrix implant system is an abutment-free implant system. So we created a new implant, and I will take my time here to explain you a little bit how is it possible that we do not use an abutment anymore, that we are able to mill or in our days 3D print into this matrix implant directly a prosthetic, not only single crowns. We can go and simplify the life also for full arch restorations very much with this. And we are 100% sure that abutment-free implants are the future of implantology. So we developed this implant, and including in this implant in our days, we creating also different applications, including digital applications. We created, for example, already 5 years ago, or no, not 4 years ago, the so-called scan bridge, which is helping you in a digital intraoral scanning workflow to scan predictable and very accurate intraoral scans. And there's a lot of applications, we call them matrix apps, which we implement into any matrix implant. And there's also something like the digital healing colors. Digital healing colors means we provide you STL files which you can drop on your 3D printer in different emergence profiles in a very anatomic shape, and they will fit on this matrix connection. You can screw retain them directly in a very aesthetic and an anatomic way onto your immediate placed implant, which is also a big topic in our days. So the focus on a matrix implant is not only digital workflows, it's not only abutment free, it's also very anatomically, and that's what we try to provide. So we will provide different services, including we working with different laboratories all around the world, which can provide you not only we only not only provide you an implant to buy, we also provide you with a complete service. That means a design service. That means also we can create you the prosthetics on top of your matrix implants. And today's we are focusing more on the scan and smile. A scan and smile in 15 minutes. I am going to explain you how is it possible to create after an implant placement, how to create a prosthetic restoration in 15 minutes. And I know that Marco is going into the details of this very accurately. So TRI is providing a plug and play system. So in a digital world, we need to be connected, and we need to be connected to different suppliers. For example, always in a digital workflow, you start with a planning. As more planning you do in a digital workflow, as more data you capture of your patient at the beginning before you will start to place an implant, as easier is now and predictable, more predictable is the outcome of your prosthetic results at the end. And therefore, TRI has to provide you an open system which is connected to all leading companies in the world. So starting with planning, we work with all knowledge on all world-known or biggest brands of planning softwares. We also can continue then the journey of a digital workflow with the digitalization, which is mostly in intraoral scanning, but also to intraoral scanning, there's CBCT scans, what you need. There's also face scanning, which provide you a complete picture of your patient, and therefore we need to have the connection from our matrix implant system to those companies. And there's also then this journey goes further. After placing the implants, we have to create a prosthetic, and prosthetic mainly is done in a digital workflow, is done with a CAD/CAM solution. So we mill our prosthetics onto our implants, but also in our days, and this is also a big part of the webinar today, we 3D print prosthetics, and we are here in a plug and play solution. So you can use our system, and you can use your 3D printer, your milling system, your chosen workflow in digitalization will fit to the TRI system. So let me talk a little bit more of this matrix implants. The matrix implant connection is actually based with or is including 8 unique patents to make it possible to provide you with a abutment-free solution. We created a new a connection which allows us to 3D print or mill into this inner connection. So I just added here a short video. You can see now from the top of the into the connection of this implant. You see here, this is not a connection. I get always this question: is it compatible, this connection, to any other implant brand? No, this connection is an unique connection made for the digital workflow, made for screw retaining prosthetics into the inner directly into the inner connection. So from the top here, you see a 20 degrees angulated conical connection with a very smooth and round inner connection. So when I start this video, you can see a prosthetic ground. You have here a quite 20 degrees angulation, a smooth and round inner connection going inside, and we have one rotational lock. You can see it here on the side now, and with the screws, which are also special developed screws for different materials, we provide different screws, and this prosthetic can be screw retained into this inner connection. And also on this picture, I think it's already getting clear that because we do not need a tie base, no bonding bases, here's no cement line, we have only polished zirconia which touches the tissue until the connection between the implant and the prosthetic. And this gives, and I know that Marco will talk about it, gives absolutely perfect aesthetic results, and the tissue loves polished zirconia. And that's why there's a lot of advantages of going into an abutment-free connection. The last thing I want to talk about is implant. We're providing you a multi-level implant. So a multi-level implant means you can see here a pink, you can see here a pink anodized surface, and this anodized surface is a machined surface. It's concave design, so you can place basically these implants not on a tissue level style from the rough surface to the pink. You can also place it in a multi-level height, so you can actually place the implants perfectly in the perfect depth to create at the end a perfect emergence profile in a very aesthetic solution. So this is a multi-level implant with this concave design and the pink anodized surface, absolutely perfect for immediate workflows. We are now with the matrix system, we having had just a 5 years birthday actually of prosthetic results. And therefore, also here you can see Marco here on that side. Marco was from the beginning on involved in the limit market release phase of the matrix system. We have worldwide users from the beginning on. We choose different users, and we have created 5 years a webinar, and also we will soon provide you with a 5-year follow-up casebook where you can see all those results and the advantages of this abutment-free and especially also cement-free prosthetic restorations. And I just want to share with you quickly before we pass the word to Marco, how these advantages can be seen in our cases. For example, here after 2 months, you can see here the bone in an immediate placement of a friend of us, of Joel Dallas. He placed for 2 implants in the aesthetic zone. And just like jumping on the 5-year result, you can see here this pink anodized area, which I was just describing, even connects now with bone. The corticalization of the bone is perfectly, and down here you can see some tissue aesthetic results. This patient, I know, is really not a very hygienic patient, but anyways, the tissue you can see here, because there is no cement line anywhere close to the bone, and this gives us a very, very beautiful result after 5 years. I said today is more about AI implant crown. We talk about single crowns today, but anyways, I would like to share with you quickly this 5-year full arch result, which was actually the world's first fully digital immediate full arch, which we did at Denta Prime and a clinic in a European's biggest clinic in Bulgaria. And you can see here after 5 years, the bone is just so stable. So also for full arches, we do not need angulated abutments or something. We have big screws, which we screw retain with 35 Newton centimeter, and we have a totally polished surface, which gives a totally nice result even after 5 years. And I know Marco will share with you also a case of 5 years of perfection, matrix perfection. Talking about that AI crown-based designing and the possibility in 15 minutes to provide prosthetics. That's more or less the topic for today. So we can place an implant in our days, and afterwards we just add a scan body, and then we do an intraoral scan. And this is now that really amazing software possibilities we can do in our days, a very simple workflow. And we do this intraoral scan of the position of the implants. We feed it in this software, in this TRI, sorry, TRI crown design software. And this is what I want to explain you. So we can feed the STL file into a cloud-based software, and then with the help of AI, the crown will be more or less designed for you. So this is a workflow which you can do in your daily business, in your clinic, very simple. And after the crown is designed, it creates an STL file. And this STL file, we just simply drop on an intraoral scanner, and the intraoral scanner, on a 3D printer, and the 3D printer will 3D print you in a certain minutes, below 10 minutes, a crown, and then you can just polish it and screw retain it into the patient's mouth. So quickly, how is it possible? I added here on the lower side, right side, a QR code. So for those of you who maybe already work with the TRI implant system, it's very simple. It's a cloud-based software. We are working together with Dentbird. Dentbird is a provider and a worldwide leader for AI-based design softwares. And we are very proud that we are the world's first company who provides a crown design software which you can use to design a crown directly screw retained into your implants. And so you can download this link, or you can check this link, and then you can open an account, and you get yourself an account name, and you create a password, and then you basically log in this cloud-based AI crown software. And now I start a video how simply it is. And basically this video is actually done, Marco, with a case which you did in your clinic. And so when Marco did the scan of the position of the implants, it's just like, as you can see here, I just stop quickly here the video. We can drag and drop 4 different scans. So there's the lower jaw, upper jaw scan, and maybe a bite scan if you want, but the software will create, when you drop it into this software, in this cloud-based AI crown software, you drop those scans, and it's very simple. So any assistant in your team can do that, and then it immediately finds the position of upper jaw and lower jaw. The next step, the AI software will show you position for 6 is missing here. There's a scan body, and then basically you just have to tell the software, yes, I want to create a crown, an implant crown, which you can see here. And then you continue. You have to tell the software, yes, I'm working with TRI dental implants. You have to tell it that you want to do a milled crown, and you have to tell it more or less which screw you want to use in your STL file later on, which you print. That's the only thing you have to tell the software. And then the software, when it knows and when it recognize the scan body, and now it happens, and it's in real time, it happens that the crown just gets designed in between 30 seconds. It depends on your internet connection, actually. And see here now, the AI software created me this crown, which nobody ever worked on it. And on this picture, you can also see I created in my software, I made it as a rule that temporary crowns will be designed 1 millimeter below occlusion, because we do not want to have any occlusal contact for a temporary crown in an immediate situation. And that's how the crown looks like. And the only thing I have to do now is I have to use this STL file and export this STL file, and you can see it here on the right side. There's an export button, and then I export it to my 3D printer. It can be any 3D printer who can print you micro material which you can use in a patient's mouth, and you can add this this STL file and 3D print your crown. In this case, here we see the Midas printer. The Midas printer offers you a printing time below 10 minutes. So you can print this crown, and afterwards you just have to adjust a little bit, you polish it a little bit, and then you can screw retain it in the patient's mouth. Before I pass the word to you, Marco, I just want to share with you this case, because we did it in the university in Zurich with Professor Ronnie Jung. And and it shows very easy how simply this scan and smile workflow works. So you extract the teeth in super high aesthetic zone. You will place an implant. In this case, we did a guided placement, and then you place the implant. you need a certain torque for immediacy. That's our scan body. You add the scan body, you do an intraoral scan, even do only a partial scan. And in the time Ronnie Jung started to do a bone grafting, the team added the scan of the position of the implants into the AI software. I think that's the next step of this little video here. And the scan then was implemented into the AI software, and then the crown was created by the AI. We didn't change anything a lot. You can change the minimum and maximal contact points. You can make the crown bigger and smaller as it's normal for any integral design software. But in this case, we just dropped the scan, the STL file onto the printer, and then the printer prints us this crown. And this crown, it looks almost almost as a copy of the real teeth on the other side, because we individualize this crown. And this is how simply this can get. And for me, I think it's fascinating that we can do that in 15 minutes. And I am now giving the word to Marco. Marco will go into the details. Marco, very warm welcome. Marco studied actually at the university in Zurich, and I heard you are sitting at the university in Zurich right now. And Marco has a very beautiful praxis in a team and in close to Zurich as well. And you are a specialist for prosthetics, and I would like that you continue with your presentation. Thank you. I think you have to
Very much, dear Holger. Is it okay? Can you hear me? I always have to ask in these webinars. Everything
Yes, you
okay?
can see. Yeah, we can see.
And also my screen is shared.
Your screen is not shared yet.
Maybe Valentina can jump.
Shared, we can see.
That's shared, yeah.
Yeah, okay. So thank you very much, dear Holger, for the warm introduction. And for me, it's really a pleasure to talk about abutment-free implantology in this webinar. And today I would like to spotlight an exciting development, namely combining the abutment-free implantology with the power of artificial intelligence, as you have just shown, for our prosthetic workflow. And I'd like to show how this combination can also boost efficiency and elevate implant dentistry in the private practice. So I'm a private practitioner. And not only that, I would like to show in this webinar that why I chose the matrix system 5 years ago. Long, I would say before it was a trend, because this is the only system that makes abutment elimination possible. And I think it completely reshapes how we think about implant-supported restorations. And because I want to focus mainly on clinical cases, I'd like to introduce you to these patients I've treated in the past, some of them just recently, but some of them also quite a while ago. And as you can see, these patients are different in many ways, in gender, in age, in profession, lifestyle, etc. But they have also some similarities. All of them are dental minded, so oral health and chewing is super important for them. And most importantly, all of them, unfortunately, are going to lose a tooth. 3 of them in the lower molar region and 2 of them in the aesthetic area. And the question is, of course, how do we help these patients when they want to have a reliable tooth replacement? And I would always emphasize that you should not forget that we have several options in dentistry to replace missing teeth. And we can restore them with tooth-supported solutions. We have removable options on teeth, on implants, or we can also use fixed restorations on implants, which is what we will focus on today. And the fact that we have several options in dentistry, for me, this is the truly wonderful thing about our profession. So we do not only need to be skilled with our hands, but we need also to exercise our brains, because we are constantly making decisions together with our patients, and we must be able to manage or even better fulfill their expectations along the way. And of course, one decision we ideally make before tooth extraction is the timing of implant placement. So we have the option to place an immediate implant at the time of tooth extraction. This means tooth out, tooth in, as the case you have shown, Holger. But we can also wait. We can wait for soft tissue healing with the type 2 approach. We can allow partial bone healing with type 3, or even wait for complete healing. And this was traditionally done in the last centuries. But to be honest, today I see a clear trend toward immediate implant placements. And I have to admit that myself, I've jumped on that bandwagon too. And the question is why? Well, because I think that in certain situations, immediate implant placement offers clear benefits. So it's the shorter overall treatment time. We have fewer surgical interventions, which not only reduces cost, but also lowers morbidity for our patients. And we have often better preservation of the alveolar structures. So this is why I think immediacy has become a major trend. And this is also what a lot of our patients want today. So a lot of my patients, they want it efficient and fast, and they want it with as little discomfort as possible. And what is particularly striking with these 5 cases I show you here, and I think they're not alone with this kind of mindset, none of them could imagine going even a single day without a provisional restoration. So I think this is completely understandable for those losing a tooth in the aesthetic zone, but there are also patients who feel exactly the same about the molar region. And so these guys, they expect a same-day solution. And for these cases, I think a very elegant way to match their expectations is providing an implant-supported immediate restoration. And of course, as a private practitioner, I want to meet this demand in my private practice. But before I jump into the case, I would like to stress that it's crucial to remember that immediate implantation with an immediate loading, the combination of these uh, 2 things, is not suitable for every case. And I would like to say a few words about one of the most fundamental keys to success in implantology in general, namely the achievement of primary stability. So we need primary stability as the foundation for successful osseointegration. And if we aim for immediate restoration, we require an even higher primary stability. So we recommend a high insertion torque of about 35 to 40 Newton centimeter. And of course, achieving this level of primary stability is more challenging in immediate placement than in a fully healed site. So for me, immediate placement is a trend, but it should always be considered as an advanced procedure. So this is not for the beginners. And of course, we may also face situations like this. So this is a hopeless second molar in the lower jaw. You see that there is a very, very narrow septum, and we have not a lot of basal bone due to anatomic constraints. Or we have a situation like here, a first molar in the upper jaw with fused roots, sinus proximity, and inflammation-related bone loss. So these conditions may simply not allow for a stable implant placement at the time of tooth extraction. Uh, and so when we plan these cases, please remember, when we plan my 5 patients, when we want to meet their expectation, we not only need to elevate their medical status, we also must carry out a thorough radiological assessment using 2D or ideally 3D radiographic scans. And of course, also the local clinical situation needs careful evaluation. So we may face soft tissue deficiencies such as lack of keratinized mucosa, for example. We may face acute infections, and all these conditions may all influence the decision on the timing of implant placement. Um, And before I think we move into the clinical cases, I'd like to give you some insight into this decision-making process we must go through when we are opting for this immediacy. So we can rely on established guidelines in the scientific literature, as you can see here, to support our decision. So in 2019, Group 3 of the 15th European Workshop in Periodontology summarized the results of 4 systematic reviews in a consensus report. And they basically identified 6 key considerations for determining implant timing after tooth extraction. And for immediate implant placement, these factors come with specific recommendations regarding contraindications. So beyond systemic conditions, they include acute infection, purulent infection, a compromised alveolus with one or more walls showing more than 50% of bone loss, then the absence of keratinized tissue, and most importantly, the inability to achieve primary stability in a restoratively driven position, or the achievement of primary stability with an improper implant diameter, meaning ultra-wide implants of more than 6 millimeters. And of course, knowing that we have also alternatives like type 2, type 3, or type 4 implant placement, we must apply these contraindications very strictly to minimize risk and ensure that only the right cases move forward. And this ultimately leads to a very strict case selection for immediate placement and immediate loading. So please do not forget that. So, and I would like to return to the 5 patients with this knowledge and also analyze them based on the factors I have just discussed. So when we look at the patients from a systemic health perspective, all of them are healthy and therefore suitable candidates for immediate implant placement. But let's go case by case, and I would like to show you these 2 cases first. So you remember that my lecture was titled "The Future is Abutment-Free," but I'd like to begin with these patients that represent the past in our practice. So before abutment-free implantology, of course, immediacy was already possible using prosthetic connections with abutments, but all of this, to be honest, came at a price, and I would like to show you, and this is what I like to show you now. So let's start with this patient and always remember also the list. So this is a 63-year-old TV presenter who was just days away from a very important award ceremony, and she developed pain in the lower left jaw. And as I already mentioned, her wish was clear. She did not want to attend the event with a visible gap, and also she did not want to attend the event with a removable provisional. So again, the question is this case suitable for immediacy? And I would like to run through this checklist. As you can see, there is no acute infection. Maybe it's subacute. We have a lot of keratinized tissue, and it appears that there is sufficient bone to place an implant with a high insertion torque, as you can see on the 2-dimensional X-ray. However, we were not sure about the infection status, and we decided to verify that the alveolus was not too much compromised using a CBCT scan and a 3D implant planning, as you can see here. And back in the days, when we wanted to go for an immediate restoration on the same data set, our dental technician designed a PMMA provisional in advance in order to attach it in the surgical procedure to a temporary abutment. And so he designed this in advance. And then we move into the clinics, and here is our classical step-by-step procedure for our immediate cases. So what you can see is that we always try to go flapless. So we go for a careful flapless extraction with root segmentation in order to maintain the fragile septum here and also the walls of the alveolus. Then for this case, we decided to go for guided implant placement, so we can go for a very accurate osteotomy and therefore have an increased insertion torque. And after placing the implant, we need to manage the site, and what we rely on in all our cases is using alveolar ridge preservation with a slowly resorbing xenograft. And after that, the temporary abutment was screwed onto our implant and fixed to the PMMA provisional, which you can see here in place. So the two are connected with a flowable composite, and the emergence profile is carefully adapted chair side using a flowable composite followed by polishing. And to be honest, this process takes a substantial amount of time. And here is the situation 3 months later when the intraoral scan was taken, and then the final zirconia crown was fabricated in the lab. So our dental technician, I would say, it's the one from the university, produced a beautiful monolithic zirconia crown, which, however, had to be cemented onto another tie base using a printed model. And I think this is a very nice outcome, even after a while, after some years. However, when I look back, I have to admit that this prosthetic workflow was, from my point of view, quite time consuming at the time of implant placement and also rather cost intense because we used the prefabricated provisional, so our dental technician will charge for it. We use two abutment, one temporary abutment, one tie base. We need to produce a model because we need to cement it stress-free in the lab. And also the cementation process is, of course, charged by your dental technician. And at that time, of course, we did not take any advantage of any AI-driven process. And this was almost the same story for our next patient. He also represents the past, and this patient had a failing incisor. The setup was similar, but this time we did not use guided surgery. Again, you can see minimal invasive extraction. I like to use the Benex system and a system for vertical extraction, then flapless implant placement and site management with alveolar ridge preservation. We always rely on a slowly resorbing xenograft. This is our standard protocol, but this is more interesting. When it came to the prosthetic workflow, I decided to modify a temporary abutment myself, this time shaping a nice emergence profile with flowable composite. Of course, this took time again. And then I prepared it like a build-up if it were for a crown. And then you can basically scan the situation, design it on your CAD/CAM system. I have a ZEREC chairside system and mill it using my chairside CAD/CAM system. And as you can see, this is the situation after a few months when we went for a scan, and a final all ceramic crown was fabricated at the end in the exact same way as before, maybe because it was the anterior zone with an additional try-in. Again, I think a very nice outcome, but was the prosthetic workflow any less time consuming at the time of implant placement? Not really, I think. Was it less expensive? Maybe just a little bit, because AI helped me within my CAD/CAM system to produce the temporary, but still, I had to use two types of tie bases, and a model was fabricated for cementing the final crown in the lab onto the tie base. So actually not a big step forward, and this was the past. So let's move on to the present. And as I mentioned, I've been practicing abutment-free implantology for the past 5 years, and this specific connection now without the abutment between implant and suprastructure can now be fabricated not only by CNC milling but also by 3D printing. And of course, this gives us different options. for the following step. I would like to show you a little bit the journey in the last 5 years. So one thing we quickly took advantage of was the prefabrication of customized healing abutments. Holger said it, you can just download a library with STL files, and these abutments, you can produce them in different emergent profiles. And since the connection is 3D printable, after printing, no, with the printing, you can really obtain them in a very, very cost-efficient way. So this is not comparable, the cost for these prefabricated abutments. And these abutments are also very easy to modify. So most of the time, I don't have to add flowable composite because I just have to select the appropriate prefabricated healing abutment, shape it a little bit. It's easy to polish. And as I mentioned, this is the most important point, extremely cost efficient compared to the standard titanium healing abutments. And of course, for cases like this one, this is a failing lower molar and a patient who doesn't necessarily want a provisional crown, you can use the abutment only to stabilize the soft tissues in this case, as you can see, to protect the graft and to shape the emergence profile during the healing. So here again, our established workflow for immediate implant placement, careful flapless tooth extraction, flapless implant placement into the septum and the basal bone, then alveolar ridge preservation with a slowly resorbing xenograft, and this time, as I said, protected with this prefabricated abutment. And we also call it the so-called socket healing abutment. And this is also investigated by Gary Finelli and co-workers that this workflow works. But most importantly, here you can see the situation 2 weeks after surgery, showing an uneventful healing and excellent preservation of the alveolar contour, as you can see. And a case like this, 3 months after surgery, the patient returns, an intraoral scan is taken, and we decided to fabricate a screw-retained zirconia crown in a milling center. So this is model-free without the use of an abutment. And here is the final outcome. So was this time consuming at the time of surgery? Not at all. I just selected the right abutment. Was it cost effective? I would say definitively yes. Not only at the time of surgery, but also in the following prosthetic step, where we eliminate the need of a lab technician, we eliminate the abutments, we eliminate the models, and we just mill it and polish it and provide it to the patient. Maybe not the most aesthetic case, but for this patient, this was a very good solution. But now I would like to return back to the topic of immediacy and to show you my third patient. Of course, at the beginning, we also began using these customized, relatively tall healing abutments for immediate restoration with our CAD/CAM system, as demonstrated in the patient with a failing central incisor. And this patient was referred to us because of a deep root fracture in a two-rooted premolar. And this case was also quite demanding, not only clinically, but from a, let's say, patient perspective. So this patient expected high comfort and also best possible outcome. And this is why I decided to enhance the outcome with a connective tissue graft, as he had a thin biotype and we wanted the best possible result. And my approach is always to prepare the recipient side. It's a tunnel for the bone graft before extracting the tooth. So you can use these tunneling instruments or blades. And other than that, the surgical workflow was exactly the same as I have shown you. First, segmentation of the roots, flapless extraction of the roots, flapless implant placement, followed by alveolar ridge preservation. So this time also for enhanced outcomes with the booster of polynucleotides and hyaluronic acid, which I have added to my xenograft. And for the temporary, I again selected this time the best fitting temporary abutment. I just needed to adapt it slightly, polish it. With that, I adapted the emergence profile to the socket morphology, and the rest follows the workflow I presented earlier. I can prepare the abutment and scan it, and then produce a final a temporary crown on my CAD/CAM in-house milling machine. As you can see in the picture in the central, I perforated the crown and cemented it on this abutment. So this is no problem, and this will take only 1 minute. So after that, a mini connective tissue graft was harvested from the pellet and inserted into the tunnel. And here you can also see the healing after 10 days, and then again after 3 months when the patient returned for the final prosthetic steps. So here is the clinical situation without the provisional, nice maintenance of the alveolar ridge, and with the scan post in situ. And since our patient's teeth had a fairly uniform color, we decided to use a multichromatic block and produce the final crown again in a milling center. So no staining was needed in this case, just milling and polishing. And I think it's a nice outcome. So when I reflect on this case, was it more efficient in terms of time compared to the other ones? I would say yes, a little, because I did not have to fabricate the build-up myself. I don't had to shape the emergent profile with flowable composite. Was it less expensive? Definitively. No abutments, no model, no involvement of a dental technician. And my patients, they like it. And here you see also the X-ray with a very, as Holger said, with this anodized surface, which can also touch the bone. I love the idea of a multi-level implant, which is provided by the TRI company with the Matrix system. However, as we have seen, there was only a minimal involvement of artificial intelligence in these cases. So this is within my CAD/CAM my CAD/CAM system. And I knew that with the new tools, we can do even better. And that brings me to the final cases, these two gentlemen. And I would say, so let's scan and smile in just 15 minutes. But first, again, I would like to stress again that the immediacy protocol is not suitable for every patient. Please remember to apply our checklist of contraindications. Are the patients healthy? Which is their infection status? Is the alveolus more or less intact? And how do the soft tissues look like? And especially, most importantly, do we have enough bone? Because when we're planning these cases, we must pay special attention, as I said, to achieve primary stability, because high primary stability is essential for immediacy, and insertion torque of about 35 to 40 Newton centimeter is recommendable. And of course, as surgeons, we can influence the predictability of achieving this high primary stability by making smart and informed decisions, I would say. For example, we may choose a more aggressive implant design. So this is not the topic today, but we can also try to under-prepare the osteotomy, and we can enhance precision through guided surgery to increase the stability of our implants. So for this gentleman here, we opted for a freehand implant placement using under preparation and a more aggressive implant body, because there was a quite wide septum, as you can see, and also a substantial basal bone where we could achieve a solid implant stabilization. And I would like to show you this case step by step in a video, also to repeat our established workflow for immediacy. This tooth is extracted, flapless, with segmentation of the roots. Then the implant is placed in the septum. And here we collect the data of the implant position already. And for this data set generated by our intraoral scanner, we have several options. So you don't have to go necessarily the AI path. We can send it also to a designer or to a dental technician for designing and fabrication within just a few hours. But nowadays, I like, as Holger has shown you, that just with a few clicks, we can basically generate the crown ourselves using AI and then produce it also directly on these high-speed printers. And the overall time for producing it, designing and producing it is around 15 minutes. And during the production process, of course, I will go downstairs. I take care of the alveolar ridge preservation. I take care of the socket using my xenograft, and after polishing, I can incorporate a 3D ceramic crown with a high percentage of ceramic for this case here, and the patient goes home happy. Again, very important, as Holger said, that the temporary reconstruction is not in full occlusal load. So again, for these patients, we wait more than 2 months. It's okay for the patients because they have a provisional, and after this healing time, this healing period, we go for the final prosthetic steps here with an additional replacement of the crown of tooth 45. And these two crowns now were fabricated not in a milling center, but by my dental technician. I think you can note also the difference in aesthetic outcome compared to the one produced in a milling center. But I like it that we have an all-rounder implant. We can go really straightforward in terms of cost efficiency producing in a milling center, but for some of the patients, you can also go for high-level aesthetics. You have all options available for these cases. And here is the follow-up 9 months after delivery with a very, very nice outcome. Here you can see the stable hard tissues. And what I always love is the stable soft tissues, as you can see on the left-hand side. So this is our established workflow. We apply it for all our cases and also the immediate restoration IR for selected cases. And because before I come to my last clinical case, let me say a few words about material selection. And I told you in the beginning that I would like to show you, because I was so fascinated about the abutment-free implantology when it was launched, and why I was also part of the limited market release 5 years ago. So I like that we have also some evidence now about this. As I said, I work for it for 5 years now with abutment-free implant prosthetic, and these show excellent results also in university studies. And for me, the potential benefits, they are clear. So the aesthetics improve by eliminating, on one hand, a grayish abutment and allowing also full control of the emerging profile. Holger didn't mention this, but starting from the shoulder, I can design whatever I want. And I think this is a big step towards personalized implant prosthetics. And on the other hand, I think, and this is maybe even more important, by eliminating a cementation process and eliminating the cement line, we also expect biological advantages. And here you can see two examples of the cement gap aged in vivo. So this is zirconia crowns cemented on a titanium abutment. And these samples, they show clearly gap formation between the titanium abutment and the zirconia crown. And on the same time, we will also replace titanium in the transition zone with highly polished zirconia. And we know this from studies that we have superior biocompatibility, which could further strengthen the biological benefits, not only by eliminating these gaps in the cement line, which may host bacteria, of course, but also by using a very biocompatible material. And I have already shown you the advantages in workflow. So the fully digital workflow gives us clear efficiency gains, saving both time and costs. And thanks to the 3D printable and millable connection, um, um, this this is really very, very efficient, and we will publish this very, very soon also. And the question is, does it work? I always hear, so there is fracture. Actually, I placed hundreds of these implants. There was no fracture at all of this crown. And I would like to show you one 5-year follow-up. Here's a case with a type 1 implant placement. This was not an immediate loading this time, but the workflow was otherwise identical. So I don't show you the surgical pictures here. I would like to focus on the prosthetics only. So after placing the implant and healing, we were again scanning the position of the implant, and our dental technician selected a straightforward procedure. So the crown was digitally designed in a single piece. It was milled from zirconia, sintered, it was colored and glazed, and everything without the use of a model. And here are the pictures taken 5 years ago at the time of delivery of the final crown. As you can see, the occlusal view shows a rather opaque appearance, but in the buccal view, we have very good color integration. Maybe not perfect, but still very impressive thanks to our highly skilled dental technician. And here is also the according X-ray. So the tooth was extracted because of a root fracture, and I filled the gap with a xenograft. And here I would like to show you the 5 years follow-up. Look at the pictures. The marginal bone remains stable, but not only stable, even improved. But what is more impressive for me always is the color, the texture, and the architecture of the soft tissues. You see the stippling. We see that in many cases, thanks to the biological and aesthetic advantages of the matrix system, I would say. So I'm really glad that I jumped early on this tray, because it's also incredibly fun to use. And this brings me into the final case, applying this fully digital workflow for our last patient uh, who is going to lose a molar, and illustrating once again the key steps for successful immediate implant placement and immediate loading. Here is also again a quick video. It all starts with data acquisition in this case. Then this failing tooth is virtually extracted. We plan the implant in the perfect connection. We jump into the surgery, flapless extraction. This time, guided preparation of the bed for our implant. We use a more aggressive implant. We can place it freehand. Of course, you can also place it in a guided procedure. Then our scan body is connected to the implant. The data is acquired again with an intraoral scanner. You can easily only cut out this the part which is, let's say, modified. You load it into the software. Holger has shown this case. Actually, I think it's the same case, Holger, you have shown before. You drop it onto the printer. Very easy. I mean, even I can do it, okay? And within 7 minutes, the crown is printed. During this time, of course, I take care of the alveolus. I will add my xenograft, remove the healing abutment, and here is my 3D printed provisional, which is again not in occlusion. And as my dental technician loved the crown because we just copied the existing crown, he just had to modify a tiny little bit. Again, you have a final monolithic zirconia crown here, and here it is in situ produced in a milling center. So this is really straightforward. And of course, I will go fast through the last slides. This is not only made for flapless immediate implant placement. You can also go for healed sites. Of course, here is a case with preceding alveolar ridge preservation, I would say. Again, the implant was placed with a very high insertion torque, and it's so easy. It really just needs a few clicks, and the AI software will do the rest for you. I just love it, and there is only minor polishing. I don't have to adapt anything. So this is really a big step forward for me, also in terms of efficiency in my private practice. Here is the printed crown. This is one of the first crowns we printed in my clinic with maybe it's the wrong color, but this was a molar. And here you can see the healing after a few days. And of course, you can also do not only single crowns, you can also do multiple missing teeth. So here we are a little bit limited with the high-speed printers, but for true premolars, this works. And now think, Holger, do I have the time to show this case, or shall I move forward?
Just finalize this case. We are already on 1 o'clock now. I think you can just finalize with this case, and then
Okay. So I will finalize with this case. Of course, you can also add, it's also possible to do GBR at the same time. This is actually what I wanted to show you with this case. It's not only suitable for one tooth only, but for two premolars, it's useful. And I know that now the companies are working on basically connecting also the chambers of the 3D printer, so we can have more units with printing, also with the high-speed printing. Designing is no problem. So the designing is ready for multiple units. Here you can see these two premolars. I try them in before I perform GBR, but of course it is possible to combine these two workflows. I think I just want to show you that here we add our xenograft for a horizontal guided bone regeneration. And I think that it will be equally exciting to see what the near future brings. We will be able, as I said, to produce longer span restorations by linking the chamber of high-speed printers, as in this case, with multiple failing teeth in the maxilla. So this case, we had to print it on a standard printer. But I'm pretty sure that we will be very soon. We will be ready for this. And these are the final pictures of an all-on X case, not an all-on, but several teeth on this matrix implant. And I would like to close my presentation. I love the implant because it's an all-rounder. It's not only for single crowns. As you see here, you can also do long span restorations. And for me, abutment-free implantology offers clear benefits in terms of aesthetics, biology, and especially efficiency, not only reducing chairside time, but also lowering overall costs for our patients. And of course, by integrating AI, these benefits can be further enhanced. And I think we're still at the beginning of an exciting journey. And for me, the future is definitively abutment-free. Thank you very much for your kind attention.
Thank you very much, Marco. Thank you very much to everybody.